Thank you, Mr. Speaker, and can I thank the Prime Minister for advance sight of his statement. I think I had almost as much notice as the Cabinet. Can I also thank everybody who works in the NHS and social care? Mr. Speaker, during the darkest days of the pandemic, they kept our health service from collapsing, they looked after the elderly when others couldn't, and they rolled out the vaccine, which has finally provided the light at the end of the tunnel. Despite their efforts, we're facing the toughest winter in the history of our health service. Not only do we have the threat of another COVID surge, waiting lists for diagnosis and treatment have reached record levels, we risk cancer survival rates going backwards for the first time ever, and social care remains neglected and strained. It is a crisis. But how did we get here, Mr. Speaker? The pandemic has undoubtedly placed the NHS under huge strain, but that is only part of the story. A decade of Conservative neglect weakened the NHS. Waiting lists had spiralled up 2 million before the pandemic. Targets were missed on cancer, on A&E, on mental health before the pandemic. The same is true, Mr. Speaker, on social care. £8 billion cut despite growing demand before the pandemic. Carers on poverty wages without secure contracts before the pandemic. 100,000 vacancies before the pandemic. And the Prime Minister has just referenced the 30,000 hospital beds occupied by those that should go into the community. And he called that, this is before the pandemic, an indictment of failure. Who had been in government for 10 years, that's just remind me. An indictment, Prime Minister, an indictment of failure is an accurate description of the situation in our health service and social care before the pandemic. So the pretence that the Prime Minister is only here because of the pandemic is not going to wash. He's putting a sticking plaster over gaping wounds which his party inflicted. He made that commitment on social care before the pandemic, and he said he would pay for it without raising taxes before the pandemic. Yes, Mr. Speaker, the NHS urgently needs more investment. But the backlog will not be cleared unless the government hits the 18-week target set out in the NHS Constitution. The Prime Minister didn't mention that. It was set and it was met by the last Labour government. So if there's to be improvements, Prime Minister, a direct question, can the Prime Minister commit today to hitting the target and clearing the backlog by the end of this Parliament? Yes or no? I know he likes to avoid these questions, but if he can't answer that basic question, it's clear he hasn't got a plan. Turning to social care. Mr. Speaker, turning to social care. Under these proposals, people will still face substantial costs. And I heard what the Prime Minister says, so another direct question for him. Can the Prime Minister guarantee that under his plan, no one will have to sell their home to fund their own care? Yes or no? But social care, well, he just told us, let's hear him make that commitment at the dispatch box, that no one under his plan will have to sell their own home to fund their own care, and then we'll come back to it. But social care, Mr. Speaker, is about so much more than this. The blunt and uncomfortable truth is that under the Prime Minister's plans, the quality of care received will not improve. There's no plan for that. People will still go without the care that they need. There's no plan for that. Unpaid family carers will still be pushed to breaking point. There's no plan for that. Working-age adults with disabilities will have no more control under their lives. There's no plan for that. Pay and conditions will not improve for care workers. There's no plan for that. Let me spell that out. A poorly paired care worker will pay more tax for the care that they're providing without a penny more in their pay packet and without a secure contract. The Prime Minister shakes his head. My sister is a poorly paid care worker, Prime Minister, so I know this firsthand. This is a tax rise that breaks a promise that the Prime Minister made at the last election. A promise that they all made at the last election, every single one of them. A tax rise on young people, supermarket workers and nurses. A tax rise, Mr. Speaker, that means a landlord renting out dozens of properties won't pay a penny more, but the tenants working in full-time jobs would. A tax rise that places another burden on business just as they're trying to get back on their feet. Mr. Speaker, read my lips. The Tories can never again claim to be the party of low tax. The alternative, Mr. Speaker, is obvious. A timetable and plan to clear waiting lists, just as we did under the last Labour government. A comprehensive reform plan for social care, dealing with the inadequacies I've just pointed out, and driving up the equality of provision. And not just tinkering with the funding model. We do need to ask those with the broadest shoulders to pay more. And that does include asking much more of wealthier people, including income from stocks, from shares, from dividends and from property. Chancellor, I was listening. But fiddling, and the Chancellor knows the numbers just as well as I do, he'll have done the sums and we've done them, tinkering and fiddling with the dividend won't do that. Instead, the government is placing the primary burden on working people and businesses struggling to get by. As I've said to the Prime Minister, if the government comes forward with a plan to genuinely fix the crisis in social care and has a fair funding model, then we will work together. Thousands of families struggling with the current system, who only want the best for their loved ones, deserve nothing less. Thank you, Mr. Speaker.